So the TimeNet procedure is new to UK and is unique in the way it stimulates collagen. In a similar way to medical needling, there is a mechanical method by which the TimeNet stimulates collagen, and in a similar way to polylactic acid, there is a chemical way in which TimeNet stimulates collagen, and it combines those two techniques in one procedure, which is very effective and causes long-term results with an immediate lift of the face. It tightens the skin, but it tightens the skin onto the structures that are already present. It doesn't involve injecting any bulk, such as with fillers. It doesn't involve weakening any muscles, and hence the facial expressions are retained, and hence a more natural look. It gives you an immediate lift, almost straight after the first administration of the procedure, and then that lift continues to mature and improve over time, and it can last a number of years. It is non-invasive, however it does involve placing very fine stillettes beneath the skin. These ultra-fine stillettes are smaller than acupuncture needles and are essentially not really felt by the patient, and therefore it's not an invasive procedure in so much as it doesn't require an anaesthetic. Once these stillettes are removed, they leave a microfilament within the lower layers of the skin, and this is the microfilament that continues to stimulate or chemically stimulate the collagen. And therefore this procedure is unique in combining both that mechanical and that chemical stimulation. So the TimeNet stimulates collagen, as I said, both mechanically and chemically. The mechanical stimulation on using the fine stillettes works immediately, and hence there is an immediate tightening and a lift of the face. The ultrafine filament that is left within the skin is actually a form of surgical suture which has been used for decades in surgery in general worldwide, and particularly in the NHS, and hence is extremely safe and slowly dissolves over a period of a month or two. The property of this particular surgical suture is that it stimulates collagen production, and hence that's how it works in order to create healing of the skin. The idea of leaving the filament within the skin continues to stimulate collagen, and hence it forms a network of collagen within the skin which tightens the skin against the underlying structures in a sort of tissue corset type fashion. Essentially the filaments are placed in a crisscross manner, and hence a net of collagen which tightens the skin against those underlying structures. So mainly areas such as the face, and it can be either upper, lower face, or the whole face can be treated. We have also treated patients' necks with very good results, but theoretically the TimeNet could be used anywhere in the body, as the principles of it working by production of collagen can happen anywhere in the body to tighten the skin. One particularly good result that we have noticed is for facial symmetry. So most people have a degree of mild asymmetry to the face, which can easily be matched and remedied by using more filaments on one side than the other. One particularly good example is patients with facial palsy or Bell's palsy. One side of the face is weak and doesn't move, and therefore at rest it's important that the patient has symmetry so they look as natural as normal. We've got a very good result of a patient who has significant facial asymmetry at rest due to facial palsy, who had an excellent result with great facial symmetry following the TimeNet procedure. Extremely safe. Particularly nowadays we tend to use temporary treatments as opposed to more permanent treatments, such as the collagen fillers used a couple of decades ago, which had a huge amount of bad press. The fact that our treatments now are temporary means that if the patient doesn't like the results, they know that these are temporary results and will wear off. Having said that, the vast majority of patients get extremely good results provided they have them applied by well qualified and established practitioners. In order to allow the safety of the procedure to be at its best, we would always recommend that the patient's practitioner is well qualified and ideally should be medically qualified. The TimeNet procedure is exceptionally safe. As I said, the filament that is left within the skin is a surgical suture that's been being used for decades, and actually the TimeNet procedure as a whole has been used in other places around the world over the last few years to very, very good results. So injectable treatments, again, are temporary, but they do not cure the underlying problem, which is the loss of protein fibres within the skin. Botulinum toxin agents, for example, will weaken the muscle that pulls on the skin, and hence the lines that are left because of loss of elastin are reduced, but they don't go away forever. Then it's not a cure. As the Botox wears off, usually over a period of about 3 to 4 months, those lines come back again. In the lower face, with static lines and wrinkles, we can use fillers, hyaluronic acid fillers, and these literally just bulk up the lines from beneath. And they can also be used in certain positions, injected in the face, to cause a facelift, to lift the skin off the underlying structures. Again, these are temporary treatments, however, and they do change the contour and the shape of the face to some extent. The collagen stimulation treatments, however, tend to cause less change to the shape of the face, simply because of the way they work. However, the ideal treatment would be to stimulate collagen in its natural form and its natural position, and hence cause tightening of the face and hence a lift.